I'm Kayla. I've had moles my whole life, and so I've always been trying to keep up with my mole checks and things like that, and have always wondered about getting rid of a few of them. I just never really got around to doing it. It was one of those things that I always put off, and then I found contour clinics.
Which ones are we removing today?
This one on my neck.
Oh yes. What I'm going to do is I'm going to do a local anesthetic injection. That's going to sting. After that, you're not going to feel anything.
Yeah.
Then I'm going to shave your mole away with a radiofrequency loop down to the second layer of the skin, and I'm going to let it heal just like a graze.
Okay.
All right. We're going to put a dressing on. It's called Duoderm Extra Thin. It's like a second skin. There's about a 1 in 1,000 risk of a red ray scar, okay, called a keloid scar. If you haven't had one before, it's unlikely, but it can still happen. So what we're doing here is we're looking to see whether you have symmetry, which you do. You've got a very clearly demarcated border, and the color is pretty standard throughout as well. You haven't noticed any growing, changing, bleeding, nothing like that. What you'll probably find is that the sun had probably very little to do with your moles coming up, and it would have been all genetics.
Oh, really?
Yeah. That's yours? That's it. So we have a mole here on the neck. It's benign. It's been there for, how long? When did it come up? When you were really young?
25 years ago.
25 years ago. So not changing, not bleeding, not growing. And when we look under the microscope, completely benign. So we're going to shave this away with a radiofrequency current. Shave the mole away layer by layer. Now the beauty of this technique is that we're removing layer by layer, which allows us to not damage the deeper layers of the skin, because we need those layers to be able to heal and to not scar. We're also not damaging the surrounding skin there, so that's also good in terms of scarring. There's a couple of ways that we could alternatively manage this. We could cut and stitch. Now on the neck, that's going to cause definite scarring. The reason for that is that she's going to move her neck around, she's going to twist her around when she sleeps, she's not going to be able to avoid tension on that scar. And wounds, when they're healing, they hate tension. So if we suspected skin cancer, that would be the method of choice. But we don't in this case. So this is a very, very benign mole. The other options are cryotherapy, where you freeze with liquid nitrogen. The problem with that is often you'll need multiple sessions and you'll almost certainly leave a scar. The other issue with that is you get some pigmentation form, or hypopigmentation. So you get a whitish patch, and once that's happened, there's no fixing that. The other option is CO2 laser, which again, you'll go layer by layer, but often you'll need multiple sessions, spaced about a month apart, and the risk of scarring is higher than if we do radiofrequency. So this is the treatment of choice. It is the standard of care for cosmetic mole removal. That is beautiful. Shaved it down to the dermis. And then I'm putting this dressing over the top, you can see. It's just like a second skin.
So it's been about 24 hours since I got my mole removed. There's been no pain, no itching, not anything like that. And I took my bandage off, cleaned it, and now I'm gonna put a new one on. Day 4 of getting my mole removed.